procedure is also known by some as a belt lipectomy or a circumferential abdominoplasty. And in essence, this is a procedure that addresses the lower trunk in 360-degree fashion. It's made up of two general components: the front side, which is like a tummy tuck, and the back side, which often is referred to as a flank excision or a buttock lift. This is a very powerful operation, and it not only addresses the front abdominal area, including skin laxity and abdominal wall laxity, but it also addresses the outer thigh, hips, or flank area, as well as the buttock. This operation commonly involves the excision of loose skin, as well as liposuction, which may allow us to defat and contour that area a bit better. This operation can be performed in one setting, or oftentimes may be staged, with one procedure being the abdominoplasty and the second procedure being the flank excision. Which direction we choose depends a lot on what your goals are and what we think is going to be in your best interest. Now, as I mentioned, this is a fairly large operation, and depending on the patient, it may or may not be combined with other procedures. So the incision in the front begins in the pubic area, and that's going to be relatively low, but it's going to help lift up that pubic area, and then it's going to start to course towards that hip area. As it gets to the hip area, it goes around the side. It's going to help address that outer thigh area and help lift and pull that area up. And then as we go more towards the back, it's going to do two things. It's going to narrow the waist, as well as lift up that rear end to get rid of some of the sagginess that you may have back there. As I mentioned, this is an extremely powerful operation and probably gives us one of the most dramatic results that we see. Now, in some patients, there may be a good deal of laxity or loose skin in the upper part of the abdomen. If that's the case, we may elect to make an up and down incision in that area. Again, that's a little bit more visible scar, and we really reserve that for those patients that really require that. This operation does require the use of some draining tubes. Depending on what the situation is, you will have one or two of those tubes in. They typically will stay in about a week's time, give or take a few days, and then we would just remove them simply in the office. As far as recovery, we've covered a lot of that in our overview. It is important to note that with this operation, you're going to be slightly bent at the waist, and it's a little bit of a teeter-totter effect, let's just say, because you've got the tightness in the front as well as some tightness in the back. It will take you about a week's time to stand up straight. A lot of patients ask me if they should use a walker when they go home. I'm not a really big fan of I'm not a big fan of walkers, mainly for one reason. It keeps you in that bent over position, whereas I was telling you before, we want you to stand up straight over a certain amount of time. When you stay bent over, it puts a lot of strain on your back and your back muscles. So a lot of my patients who use walkers at home tell me they have some long-term back discomfort until they're able to stand up straight. The last thing that I'll share with you that seems to be helpful in the recovery period for this operation is to get a little seat extension on your toilets. You can get them in any drugstore, and it adds about 6 to 8 inches. A lot of the toilets today are on the low side, so this makes it a little bit easier to stoop down and go to the bathroom. After the surgery, we're going to put you in a binder or corset, and this is going to give you a lot of support. You'll actually feel much better with it on. We'll commonly have you wear this somewhere around 2 to 3 weeks. There's no problem with you wearing it any longer than that, but most of the time after about 3 to 4 weeks, patients are healed enough that they feel fine without that extra support. A lot of times after the first 2 weeks, we may transition you into a Spanx so that you have that support. It's not as cumbersome, particularly if you're going to be going back to work, as some of the binders that will put you in.